Yeah, so just show them the difference between this, the considerations for putting the patient on the board. It's similar, but you obviously got this injury that you're dealing with.
We've already put the splint, traction splint on the patient. Clearly that's the injured leg. We will log roll the patient without head stabilization. Never onto the injury.
Yeah.
Okay? So which way are we rolling the patient?
Towards you.
This way. Okay. So I need one person here with me and one person to hold the backboard. Okay, and we will cross so we do not grab over the injury. Normally you'd grab here. So I'm going to look for probably the iliac crest, and I'm trying to not mess with the splint itself.
We don't actually have tension on that, by the way. It's just there.
Okay. On 3, are you ready, by the way? Yes, you ready, Tom?
Yep.
Okay.
Good.
Let's okay, 1, 2, 3.
Spine.
Yep, if it has not been checked.
Backboard in. Push.
Okay, and then on 3, okay? 1, 2, 3. Okay.
I did not put that high enough towards your head. Your pillow was in the way.
Okay, I've got that stable. Okay, so now, can we get this backboard straight on the ground? There we go. Okay, could I use the blanket? Yes, there you go. So we are looking for a way to add stabilization here.
My head.
Right.
Is it off the board?
Yeah.
Yeah, she needs to go down about 2
Okay.
And she still has one cushion her head, and you can be her hood. But you don't want to have.
So we will adjust by moving the patient down. So can you grab under the arms or by the shoulders? There you go. You watch the leg. Okay. Go to lower legs. Okay. At the head, can you count?
Yeah.
And tell us
How
which
far
way
are we
to go.
moving down? What, like?
Or her head needs to be.
Her head needs to
Okay.
be.
Let's do 5 inches.
5. Okay, ready? On 3. 1, 2, 3.
Good.
Okay. And then
Just made a mess of your hair.
we try to not move this leg. We bring this leg as close as we can. Can we cravat the legs? And then we will lay out, we won't do all the full backboard, but just to show you how we would strap the patient.
I got
We go.
So what's the consideration here when strapping? What's the big?
Well, so the consideration is we
consideration.
have a major injury
Right.
here, and the usual crisscross would go over the injury, and we can't do that. So what we will do instead, we will do the chest as usual, right? And then, so as I look at it, I go, okay, the injury is here, and I need to stabilize the hips. I am fine going this way, right, as I normally would. So lay out this over iliac crest and down here. And she doesn't even want me to touch that. However, her pelvis is okay. I just can't strap over the femur. So I will do a shallow X here to get her iliac crest here and here, okay? That allows me to achieve almost as good stabilization as normally. Now, normally we put a strap over the femur here, but that's the bone that's affected. It's not exactly the injury, but we don't want to destabilize the injury. So instead, we will put 2 straps on her lower legs. Okay, and the really important thing is that there is no wobbling here between the legs. So I will check, I might even go tighter on this, unless I can tighten that with a strap. So that's what you're checking for. And of course, CMS. Yeah. Patient will be fragile.
Makes sense?
Okay?
We don't have to take the head. We don't have all the same considerations, but you probably should just do it more or less the same. You'll notice that the patient helped wiggle herself into the middle, right? Because we're not worried so much about transverse movement, but if we're gonna move them, we're